night, everyone that is arriving into this webinar. First, I would like to thank you all for joining and tuning in tonight in this webinar. In the beginning, I'm going to go briefly over technical stuff. So as you can see, you are all muted and your camera is off. It's not that I don't want to hear your voices. I would love to hear more of you in the chat box or in the Q&A. So please don't let your questions go to waste. But obviously for the smooth evolvement of the presentation, it's better like this. As most of you know, tonight is in context of my bachelor thesis. So I'm presenting my evidence-based nursing results as a nursing student, fourth-year nursing student. And because of that, because of that, and before I go ahead with the rest of the webinar, I need to thank a few people that supported me along the way to get here tonight. So I would like to thank the support of Thomas Moore, and a big thanks to IDF Europe to help me host this webinar tonight, and also all the people around me who supported me in these rather stressful times. So to go ahead, I will show you the agenda of tonight. So we will start with opening remarks from Elisabeth Dupont. And after that, I will give a short introduction on hypoglycemia and fear of hypoglycemia. And when we know more about that, we will go over with the video testimonials. And of course, then we will deep dive into the evidence-based nursing results. And we close this call with a panel discussion with a lovely panel that will join us tonight. So I will give the floor to Elisabeth right now.
Hi everyone, and good evening. Thank you, Marta, for giving us the opportunity to open this webinar. It's very special to us for three reasons. The first one is that hypoglycemia and the fear of hypoglycemia is definitely something very important for the diabetes community, and as you will show it during your presentation, many people living with diabetes experience that fear. The second reason why it's important for us is because in your presentation, you also highlight the important role of the nurses. And at IDF Europe, we really believe that the nurses are essential in supporting people with diabetes and their families in the management of their diabetes. And then the third reason is that it's your bachelor proof tonight. And we know it's an important moment for you. And we wanted to be there for you as you have been there for us for nearly 2 years now. I'd like to take the opportunity to thank your school for allowing us to welcome you and to have such a dedicated person in our team. And I know that the entire team of IDF Europe and possibly some of our board members are on this goal, and we wish you all a very successful webinar. Thank you.
Thank you, Elisabeth, for the very kind words. I will now go ahead with the start of my presentation. So, as we want to know more about fear of hypoglycemia, we always need to start with the base. And of course, that is what is a hypoglycemia. So, the pure medical definition of hypoglycemia is a low blood sugar. And more precisely, this is a blood sugar below 60, 70. But as I mentioned before, this is clear medical language. But if we want to understand better what hypoglycemia is, it's much more than a number. So hypoglycemia comes with asymptomatic or symptomatic symptoms, of course, and it can be from sometimes unknown, or sometimes you don't immediately are aware of the symptoms, but it can escalate in what happens most frequently in autonomic symptoms which you can always recognize as fight or flight symptoms, but it can also be in a more dangerous stage, which are the neurological symptoms. And those sometimes require help from a third party, which means that this is seen as a severe hypoglycemia. So the definition of severe hypoglycemia is not always based on a number, but based on whether the patient needs help or not, or is able to treat the hypoglycemia by themselves or not. So as you saw, hypoglycemia has a lot of symptoms, but it also has a lot of side effects. And one of those major side effects is fear of hypoglycemia. And as it's very logical that fear of hypoglycemia is a specific and an extreme fear evoked by the risk and the occurrence of hypoglycemia. So it's not necessarily experiencing the hypoglycemia, but also the risk of having it. And actually, it affects 1 in 7 people with diabetes, which is quite a lot. And as mentioned before, it can occur on any time of the day, and this can affect your social life, for example, your work or the workspace you live in, but also your sex life and your sexuality. For example, when you are scared to have sexual intercourse because you might have a hypoglycemia due to the change in physical activity, but also sports. And most of the time when you are having or doing a team sports, your team is counting on you, and there might be a provoked fear of not being able to participate enough. But those are only a few examples on the impact that it has on your life and your body. But an important note is that fear of hypoglycemia is not only a thing that people with diabetes experience, but also something that is frequently shared with their friends and loved ones. So they also feel the effect of fear of hypoglycemia or have the fear themselves. So as we know more about fear of hypoglycemia, it's also important to know that an absence of fear can also be something very dangerous. So being concerned about hypoglycemia is needed because it keeps you as a person responsive to hypoglycemic symptoms, and it makes you handle timely and adequate or follow a good treatment. If you the faster you can anticipate, of course, the less worse the problem will be. But if this evolves into an extreme excessive fear, then you create fear of hypoglycemia. So it's difficult for a lot of people to find a balance between not taking care of the feelings in your body and not anticipating on hypoglycemia, and too much anticipating on hypoglycemia. So as we know more about hypoglycemia right now, I would like to share some testimonials from people living with diabetes that want to tell you more about what it actually is for them or what they feel themselves.
Okay, so I'm on a CGM at the moment, and I have been loving it because I made the change because I was getting really scared about not feeling my low blood sugars during the night. And this really gave me a sense of security that I had been missing during the night, because during the day other people can see my behavior change because I look like a drunk, and I really do feel it. But now I have to change back to another device, and it really scares me, and I don't feel like the people at the hospital are really taking care of me switching back to something else, because it does really frighten me, and it's just going to be one change out of nowhere, so it does scare me.
Alex from Scandinavia here. My biggest fear when it comes to hypos is to die in my sleep. It's always been a fear of mine. It's the one time of the day when I'm no control. But thanks to specific CGMs, I'm more hopeful now. and it has somewhat decreased that specific fear. Nurses, I need you for emotional support. Yep, I know how to treat and run my diabetes pretty well by now after 17 years, but I feel like I'm alone in this a lot of the times, and it's super nice to just have a conversation. But listen here from a professional. Thank you. Bye-bye.
One of the main things that I'm struggling with when it comes to dealing with hypoglycemia is how helpless I feel during and after hypo. I sometimes just feel like I'm losing control over my body, which is incredibly scary. And I sometimes feel like it just holds me back, despite always trying to advocate that I can do anything. Although I have type 1 diabetes, but hypos just sometimes give me that feeling that I cannot do everything that I want to. What nurses can do to help me feel better when it comes to my hypo anxiety is definitely just listening to my concerns and making me feel like my feelings and thoughts are valid and not dismissing them, and just supporting me, giving me advice, and just letting me know that I'm heard and seen.
All right, so as I know that all the speakers or the ones that send in a testimonial are on the call tonight, I would also like to thank them live on the call for their wonderful testimonial and their honest testimonial about a very difficult topic. So thank you, Alexander, Mirte, and Anna, for your help in this. So this was a perspective on the life of people with diabetes. But where do we stand right now when it comes to support and healthcare? And actually, while doing my research, I discovered that we have quite some information and research available about the topic. And one of the most important things I feel is the hypoglycemia fear survey, because you can really assess fear of hypoglycemia, and it's a very easy handmade tool, not only for healthcare professionals, but also it's also adapted for the relatives and partners. So it's a tool that is widely used, but as the research told, not widely enough. So this also might be an encouragement, not only for healthcare professionals, but also for people with diabetes and their partners to ask for the questionnaire, because it might help them to understand their feelings better. Yeah, I do like the tool very much, because sometimes I think it's very difficult for a healthcare professional to start a difficult conversation, and this is somehow a very practical way of starting, or accessible way of starting a conversation that might be difficult. So there is a lot of acknowledgement about the condition, and there is also a clear association on the complications or the consequences of fear of hypoglycemia, which is quite encouraging for future research. And there is already encouraging research about the treatment and therapy with cognitive behavioral therapy. So the future is looking slightly brighter as I was doing my research. So what can trigger fear of hypoglycemia is also something very important before we continue with the evidence-based nursing results, because some of them might be very logical. For example, as Alexander mentioned in his testimonial, that nocturnal hypoglycemia can give an increased anxiety about dying in one's sleep. And it's not only being scared before you go to sleep, but also when you experience a hypoglycemia during the night, the symptoms you feel can also be very scary, because you wake up with an increased heartbeat, you are sweating, and it literally feels like if you don't have sugar in a few minutes, then I will die. And it's a very scary way of waking up. And obviously, it's not happening all the time, but if it happens once, it increases your fear of experience it again or letting it happen again. So, for example, when I experience more than one hypoglycemia during the day, I'm always scared to go to sleep. And if I experience a hypoglycemia right before I go to sleep, which happened last 3 nights, I can't stop eating what is around me, because I'm so scared of still not necessarily dying in my sleep, but also the consequences that you experience when having a hypoglycemia during the night. So most of the time I eat so much that my sugar values go up to 250 and 300, which are values that you need to take insulin for to lower it. But I don't lower it because I'm scared that if I have an intake of insulin at that time, things will go wrong during the night. And when someone is next to me, obviously I sleep way better and I feel more secure, but it's not a security that every person has or has it all the time. So also severe hypoglycemia and most of it past negative experiences of hypos and the discrimination that sometimes comes with it. For example, awkward behavior in public, as Mirta was saying, that she felt drunk, or she always feels drunk. I can acknowledge that she looks like a drunk when she's having a hypoglycemia, but that can cause a lot of awkward or inappropriate situations in public, but also sometimes in private situations. And if you would say discrimination in workplaces, it might be something very extreme, but it happens a lot. I can give the example while doing my nursing internships that I was in a period of a lot of hypoglycemias, which were provoked by the fact that the physical activity was way higher, that working in shifts can be quite challenging for a person with diabetes, and the therapy. And I was experiencing sometimes 5 hypoglycemias during one morning shift only, which made me take a break and sit aside for quite a long time. And at a certain point, the head nurse came to me and she said that if I would stay like this, so having diabetes and hypoglycemia for the rest of my life, which most probably will happen if we don't find a cure, that I will never be able to be a nurse or to be like have a proper place in a working society, which increased obviously a fear of experiencing hypoglycemia on the working space again. So the weeks after, because I was scared for my grades and all the stuff that happen when you are an intern or an employee, so I was constantly increasing my blood values higher, so that the hypoglycemia would not happen or less frequently happen. So I was not injecting enough insulin just to make sure that I will not have a hypo, or I was eating more sugar than I supposed to do. And when I did have a hypoglycemia, I went to the toilet to eat my glucose steps because I was scared of telling that I had another hypoglycemia. So this is a very dangerous situation, and I think it's not really normal for people with diabetes to sit on a toilet to eat your sugar cubes. So this is something that's not that much spoken about, but also a very important consequence of fear of hypoglycemia. And something very important too is the parents' fear of hypoglycemia, and also the impact or what reflects on the child itself. So managing the threat of hypoglycemia, and for sure if your child had severe hypoglycemia in the past, is very, very difficult, because you can only see the outside symptoms, and most of the time when you see them it's already too late. So sometimes for parents there can be a very big guilt feeling about not anticipating on time, or sometimes being too late, and your child is having a severe hypoglycemia, because you can't see what's happening on the inside of the body of a little child, or even a young adult. So that's very, very difficult for parents. And that fear, or the over consciousness, can also make the child scared, or fearing hypoglycemia. So it also sometimes happens that children, or most of it young adults, who self-test, that lie about their numbers, for example, to not let their parents panic more, or several other reasons why they would do it. So there's not only a good trust or a good relationship between a child and a parent when it comes to the results, or the sugar values, or the blood values. So more in-depth research results, when we focus on metabolic control, there's a clear association between fear of hypoglycemia and a greater glycemic variation. So this means that there is more variation in the blood glucose, or more, as you can say, for example, spikes, and or people, for example, they have a higher calorie intake, and to make sure, as I mentioned before, that you not get in a situation of hypoglycemia. But sometimes it also stops people from doing physical activity, or just a very low amount of physical activity during the day, because they are scared of hypos. Then there's also, or it's also called, obviously, hypo-avoidance behavior, but in an inappropriate way. As I mentioned before, the increase of food intake and not lowering elevated glucose levels. So it can lead to over and under compensatory behavior. So your people with diabetes are more likely to over or undercompensate in different aspects of the metabolic control. So when we look at the mental health or diabetes distress, there is still a clear difference between mental health and quality of life. So mental health, there you see a strong association between FOH, fear of hypoglycemia, and non-diabetes related anxiety. So that's something nurses also need to take in consideration, that those are also there and increase the fear of hypoglycemia too. And also a history of traumatic hypo experiences or severe hypo experiences can affect the mental health too. And a fact is that hypoglycemia is one of the major sources of diabetes-related emotional distress. And this is because people with diabetes live in a constant risk of hypoglycemia due to the impaired glucose homeostasis. So it's not that the risk isn't there for one day. Every day there is a risk, and you can never expect when it will be. Sometimes you follow the books as good as you can, and still it happens. So as an example, last weekend I went cycling with my best friend. My sugar value was perfect in target. I lowered my insulin before I started the physical activity. We were talking, cycling, and suddenly I said, yeah, I think I have hypoglycemia. And my blood glucose was at 32, which is extremely dangerous and extremely low, but I didn't feel it at all. So I followed the books. I did everything that I needed to do, and still it happened. So it just overcomes you. And that risk is a very heavy burden if you live with diabetes. And also hypoglycemia varies from asymptomatic and unpleasant symptoms, but also neurological disorders, and in extreme cases, coma. And I don't need to tell you that knowing that there is a chance that you will get into a coma is quite heavy to wear on your shoulders every day. So when it comes to quality of life, I'm not going to repeat, of course, nocturnal hypoglycemia, or even, well, if I can say hypoglycemia during major activities. I also did a lot tonight because my major activity is presenting my bachelor thesis, and I did a lot to overcome, or to make sure that I don't have a hypo tonight, which is basically saying the reverse thing, which I'm telling all night, but still the fear is there. So also the shame and awkwardness in social occasions, I've already told. But the diary entries of several studies also showed a broader picture on an ever-present chronic anxiety because of hypos, and also an inevitable feeling of hypoglycemia all the time and a lack of control. And this is also something that Alexander told in the video, that the lack of control is something that is very frightening. So when we look also in technology, then also a lot of different therapies and diabetes regimen were also investigated. But despite the very latest treatments with insulin therapy and other technological devices, still a lot of people report having some degree of fear of hypoglycemia. And as Mirte told in her video too, and also Anna told, and for sure Alexander too, they all have CGM, which is continuous glucose monitoring, but it helps a lot, but it will never take the fear away completely. And also when it comes to CGM, this is a very important tool for people who have impaired awareness of hypoglycemia, which means that they are unaware of having hypoglycemia. So that's why most of the time it's already severe, or they are too late to anticipate because they don't feel it anymore, which is quite similar to the situation I had last weekend with not feeling my hypo, and suddenly I was 32. And that was also because my sensor of my CGM was not working, so I did not have the alarms anymore. So there was nothing external that gave me a sense of signalization that I was dropping, or my blood glucose was dropping. So obviously access to technology is not equal in Europe, and that's why it would benefit so many patients for several other reasons too, but for sure for fear of hypoglycemia, that everyone has the right access to healthcare and technology. But there's also a downside of technology, because when you are constantly aware of your numbers and they are constantly shown on your pump or another device, it sometimes makes you anticipate too quickly on something you wouldn't anticipate on it before. So people who have fear of hypoglycemia are constantly confronted with the numbers, and therefore are it happens a lot that they anticipate too early or take sugar too early because they see, oh no, my sugar is dropping, but most of the time it gets itself in range, or your body is anticipating on it. So that's also something important that needs to be taken in consideration. And then we come, of course, to the role of the nurses. And this is an important quote that I found in the research, because it's saying a lot about why I'm here tonight, and also about the fact that the knowledge is there, but there needs to be more awareness and about the topic. So the role of the nurse is huge. In my opinion, it's amazing which difference nurses can make for patients with diabetes. And most of the time it starts very easy, and that's the raising awareness part and talking about fear of hypoglycemia. And this can easily done, but nothing is easy, I think, when every patient is different. But we have the tools, for example, the fear of hypoglycemia scale, or the assessment, but also just asking about the feelings of a person with diabetes can sometimes, you can sometimes anticipate on the behavior or the hypo-avoidance behavior of people with diabetes. And also each patient requires a unique and individual approach. So if you know that a lot of non-diabetes related fears and anxieties have an influence on fear of hypoglycemia, it's also important to know for nurses that they have the complete image of a patient, and also know that they are most likely to develop fear of hypoglycemia if other anxieties are already in the picture. So touching upon feelings and emotions during clinical consultations is obviously one of the key ways to understand the daily metabolic control and behavior of people with diabetes. And it's important that strategies take place, or that they develop ways to reduce the risk of hypoglycemia. And this always starts with educating your patients, but also the environment about hypoglycemia, about the danger of hypoglycemia, but also the solutions and a way of easing those fears, but also adjusting therapy. So looking to the metabolic control and seeing how you can adjust situations. For sure, with insulin therapy, it's more easy to anticipate on several times of the day to adjust the therapy and lower, for example, your basal insulin. But also looking at alternative insulin regimens, if possible, for example, to switch from pen therapy to insulin therapy, or when you see that insulin therapy is too difficult or having a negative influence, switching back to pen therapy. And also BG awareness training. So that's getting the awareness of people, or the awareness of hypoglycemia back for patients. So it's also a therapy that nurses can conduct to get the awareness back, and also the CGM and technology, as I mentioned before, is very important. We are almost coming to the end, so a very useful tool for nurses and for not only healthcare professionals, but also family and friends, is the 7 A's model. And it's, as you can see, 7 A's. And it starts with be aware that the people with diabetes may experience the extreme fear of hypoglycemia. So in a certain way, what I'm doing tonight is the awareness part, making sure that everyone is aware that this is a very severe problem for a lot of people, 1 on 7. And it's not only for healthcare professionals, but also for the people supporting me or supporting another person with diabetes. And very important, if you are aware, it's important to ask. So just asking helps so much. If I would be in a clinical consultation, it would mean so much to me if my diabetes educator just asked, like, oh, why did you do this in that certain situation? May it be possible that you were scared to evoke hypoglycemia or something like that? Because I know that they recognize it and that my feelings are valid, as Anna mentioned in the testimonials. And the next step is to assess fear of hypoglycemia with a validated questionnaire, as mentioned before. And when you did the assessment, it's always important to advise, but also to know your role as a nurse. So you can assist with the developing or an achievable treatment plan to help patients with diabetes. But if you feel that there are other disciplines needed to get involved, then you need to assign to another healthcare professional and not only take the role for yourself. And if you want to make sure that the feelings are valid, then you also need to have a follow-up and not just dismissing it, as Anna said, but have a real follow-up on how the situation is going, and have maybe even a more frequent follow-up than only 4 times a year. Maybe you can say, okay, maybe it's better to come back if you want to in 2 weeks, so we can discuss how we go forward. And those are the most important 7 steps to undertake, which every healthcare professional can undertake. So far so good. I stopped my screen sharing a bit too early. I'm sorry for that. So I'll go back for one super important slide, which is the panel discussion. So I'm very happy to welcome Alicia Borne, the diabetes specialist nurse of the evening, Cristina Petrut from Romania, who is a clinical psychologist and also a person living with diabetes, and someone you saw before in the videos, Mirte Winters, and she's, as you know, a person living with diabetes. And I think that they are joining me right now when they turn on their camera. So they have the permission. All right, so here's my wonderful team. So welcome to you all. As you know, I'm not going to say boring, but the more dry information is over. So now we are going to have a short panel discussion. So I would like to start with Christina. As I mentioned before, she's a clinical psychologist. And I wondered, as a clinical psychologist, if she saw fear of hypoglycemia before in her daily practice, or that she recognized the problem or have treated patients with fear of hypoglycemia before?
So, hello everyone. It's so nice to be here with you all. And first of all, Marte, congratulations for all your hard work, for choosing this topic, for a wonderful presentation. And I'm sure that in all your life practice, you will do a wonderful job, and patients you will be talking with will be so blessed to have you around.
Thank you so much.
So answering your question, yes, of course, there's so much more than we can imagine. There's so many people that are dealing with the fear of hypoglycemia. They might be not necessarily clinical, so just a thought on their mind. But most of the time, we do see those behaviors you were talking about and those powerful emotions. I've seen patients that are being afraid of going outside on social events, maybe because of the fear of hypoglycemia, being in a relationship. There are also, I had patients that were afraid to even talk about their symptoms with someone else because they would be judged because of them. Also, I have patients that are afraid of hypoglycemia because they don't feel the symptoms. So it's that hypo-unawareness, or they've been through a severe episode of hypoglycemia as well. And another interesting case I'm having is someone that has such an unpredictability in hypoglycemias. So now it's 300, in 20 minutes afterwards, they have a hypo. So I've seen this fear of hypoglycemia indeed in patients with type 1 and type 2 diabetes, and a lot in parents of children with diabetes. And I think, just as a comment, it's so much harder to manage the fear of hypoglycemia in parents that it's in person living with diabetes, because when having diabetes, maybe you have a better control. So there's so many things you can do about it, as you said, but when it comes to our children, then it's more difficult to do it.
Thank you, Christina. It's very valuable. And I can really say, when I go babysitting on children with diabetes, I sometimes feel even more bad that the parents have to deal with the diabetes than I have to deal with diabetes themselves, because there is such an unknown pool of things that you don't see, that you don't feel, that you live with the condition because you are constantly managing it. You are the manager of your child in a super extreme way, but you are not feeling it physically in your body. And it's so difficult that sometimes a child has awful behavior because it's a child, but it's so difficult to see, is my child in a toddler crisis, and is that the behavior, or is it having a hypoglycemia, and is it just moody because of the hypoglycemia? And sometimes you punish your child, or you're saying, okay, go to your room and cool down, and then it's having a severe hypoglycemia, and you were the person that was saying go to your room, and there it all happened. So I think it's very difficult for a parent indeed to cope with that fear. Thank you for your input. All right, so I think, Mirce, you have experience too with children and diabetes.
Yes, I also babysit on children who have diabetes, and there was a time with another family, not the one I'm currently babysitting, where I used to stay overnight just so I can do like the night checkups, and they would actually pay me to do that so they can have one night of solid sleep where they don't have to be worried about all the alarms going off, especially when you have a small child. The ratio is very sensitive and it's really hard to get that on a straight line. So I definitely get that part where the parents are just like, what is this? I just want to sleep. I don't want anything to happen to my child. So I definitely can understand and relate to that as well.
Thank you, Mirta. We had a lot of discussions about this already, so thank you for your input. So I would like to go over to Alicia. She's a diabetes specialist nurse. And I wondered, before I asked you to join the webinar, did you came across fear of hypoglycemia during your education or as a nurse or in your work space?
Right. Hi, everyone. Like Christina said, Maartje, you're doing a great job. And I want to tell you this thing. But well, as a general nurse, you know what hypoglycemia is and what to do, but we do not really dwell on the fear that this creates. But okay, as an educator, the concept of fear of hypoglycemia is of course not unknown. Sometimes you can easily recognize this fear of hypoglycemia by the way they express emotions. Patients can cry or they just report that they're anxious. Not unimportant is also recognizing compensation behavior. Like you told before, sometimes it's unconscious behavior for the patients to avoid those hypos. But yeah, it's up to us to listen to what's going on and make them more conscious of underlying fear. And out of curiosity, I asked this question to a few colleagues, and they do often focus on our main goal, control of glycemia. And we have to remember ourselves really that reducing the frequency of the hypos doesn't mean you're less anxious. So metabolic control must be addressed along with anxiety. That's very interesting. And knowing is one thing, but applying is another matter. Yeah. So it's a very interesting thing we discuss right now. Yeah.
I'm happy that you say that, Alicia, because lately I was at my nutritionist and we were discussing my values, and at a certain point I had a hypo and then I spiked to 250, and she said, she was a bit mad at me, and she said like, yeah, but you shouldn't have eaten so much and you need to work with your insulin pump and lower your basal because your basal will do it and you don't have to eat that much. And she was so much focusing on me not getting fatter because I ate too much cookies. And I was saying, but yeah, but I'm so scared for sure during the night that something will happen, and I'm scared and I'm scared and I'm scared. And the only focus was, yeah, I know that you are scared, but you need to lose weight and you need to eat less cookies. But that's not, it will never solve my problem by just saying you need to eat less cookies, because I would love to eat less cookies. It would it would make my life so much easier in a lot of ways. But it's so difficult if the focus is only on the numbers and following the books, because there's so much more than following the books alone. And when we are talking about books, do you feel that there is enough information available, not only during your education, but also later when you are working as a diabetes specialist nurse?
Yeah. It starts like 10 years ago, so I can say that I have had a shortage of information when it comes to my private life. Like 10 years ago, when my sister, she also has diabetes type 1, and I did not know anything about this emotional support. And if I had known earlier, I could have taken more supportive role as a sister. I've really, really, really missed that information. But it's like 10 years ago, so I think family is now getting more involved. And then 3 years ago, I just studied as an educator. And then the concept fear of hypoglycemia was discussed during my education, but only briefly in the bigger context of psychosocial well-being. Although we often revert to a result-oriented approach and more specifically focus on the metabolic control again. So no, that's why I'm very interested in what Christina as a psychologist has to tell me, and because I know I have to learn more and more. I'm also young. I think colleagues who have more experience, well, yeah, they have more, yeah, experience. Yeah, it's for me. I have to, yeah, search a way to, yeah. It's not easy.
A better feeling or a better touch because they do it more often, the clinical consultations.
Yeah.
All right. So thank you, Alicia. It's very valid. So as we are reaching out on tools, or as I mentioned before, there's a lot to do with cognitive behavioral therapy. But I wanted to ask to Christina, which coping mechanisms or treatments do you currently use while treating patients with fear of hypoglycemia or other diabetes-related anxieties? Because there are a lot, of course, more anxieties that come with diabetes.
Indeed. And actually, we need to understand that this anxiety, it comes out of fear of immediate danger. So as you said previously, in a way, it's normal to have it, right? Because this is how we can protect ourselves from the danger, from dying actually, and that's good. But having too much fear, that's a cognitive pattern that needs to be changed because we can no longer enjoy our lives actually. And then from having this anxiety, we might even have depression. We might be in burnout. Imagine constantly having to check your blood sugar levels. What happens if you forget your cookies at home, for example, or your glucometer, or you don't have a CGM? So there's so many situations that can happen, right? And this might affect your emotional state. So what we do actually in therapy is focus on emotions, validating the emotions. It's okay to be afraid. It's okay to feel the way you're feeling, and let's see what can we do about it. Then we focus on cognitions, meaning that how we evaluate the situation. Why do you see a particular situation being as dangerous as it is? Then focusing on behaviors. Are you overeating? You don't inject insulin. You prefer not to go outside or do any other activities. Let's see why you're not doing them. And try to restructure the way of seeing a hypoglycemic event. So that's the first thing to do. Well, then another thing is actually to help the patient to understand better what is going on. What can we control in the situation? Can we prevent a hypoglycemic event? Can we treat it accordingly? Is there something else we could do, as in having more sugar, as in having a bottle of juice next to your bed if you wake up in the middle of the night? Is there something else that you could do? And also, usually I'm trying to establish a relation in a way with the diabetologist, meaning that the doctor is the one, or the nurse or the educator is the one that needs to give all the education information, right? So I'm constantly working with them in order to create a team for that person. So the thing is that we are afraid of telling most of the time. So what I've seen from practice is that we are afraid to talk about our emotions. We are afraid to talk to maybe our doctor about it because we are being judged or we are not being understood. It's like if I'm having a severe hypo, maybe I did something wrong. Maybe I've done too much insulin. If I'm telling this to my doctor, she might say, well, you do it all wrong. So it's your problem, which is not normal. because this is why actually we don't tell and we don't talk with our doctors, we don't talk with our families about it. So another thing that I'm strongly suggesting is people to talk about their emotions with the doctors, but with the families and friends, and make sure that people around them knows how to treat a hypoglycemia, so they can really have the support. Sometimes we think that, let's say, if I'm having diabetes for a long time, these are things that I should know, but that's not true. So maybe I don't know it, or maybe I'm having a burnout episode and I don't care about my diabetes anymore. So we need to tackle all this information. And basically, these are the coping mechanisms we are trying to develop in practice, just to make sure that you have the information, you know what to do, and you can focus on what is controllable and enjoy life, of course. Does it make sense?
Yeah, it makes a lot of sense. It's so relatable. Literally every word that you said is relatable. And I was very impressed by you saying, like, we are scared to be judged. And that's something I experience a lot, because I obviously know that a lot of the times it's definitely my fault that I had a hypoglycemia. And when my doctor is saying, like, oh, here you had an episode and why was it, and then I'm explaining, and yeah, I didn't do that and I could have done that, and most of the things that she's replying is, yeah, but you should have done that, you should have done that, you should have done that. And indeed, a major amount of things that I could have been doing, but I'm the manager of my life 24/7, and I also get tired of being the manager of my life. And I would love to have someone that is taking one day all the worries away, or taking care of me for a complete day, 24 hours of rest. So it's also very normal that people with diabetes have hypoglycemia. Although the books are saying that it's manageable, sometimes it isn't manageable. But I'm also scared of talking about it, because I know that my healthcare professionals most probably will say, yeah, but you did that wrong, you did that wrong, and then I'm not talking about it anymore, or I'm maybe not telling the truth about what really happened, because I'm scared of judgment, which is also something that happens a lot.
It's like it's becoming a taboo subject, which is not normal, because it's something we experience so many times in life. So maybe twice a day. Imagine pregnant women that in the first trimester of pregnancy, they have so many hypoglycemia events. So we need to tackle this. Also, as you said that you're feeling judged, for example, if you would just change the way you're talking, is like, you should have done that. Why would you say, well, next time it happens, you could do this and this and that, and that then it's an advice. It's not a judgment.
Yeah.
So that's so important to do. And also, I think there is a lack of discussing the situations where you could have a hypoglycemia. Even when talking about alcohol, right? You won't say to your doctor, I had a hypoglycemia because I drank some vodka, right? But this is something that should be known and be educated about.
Yeah, indeed. So I feel that Mirte was also wanting to jump in on the topic.
Yes, definitely. I think I have a very open relationship with my educators and with my nurses and with my doctor. Like, if I have a hypoglycemia that's due to alcohol, I will definitely tell them. I'll be like, oh, I had a moment where I had some drinks or wine in the evening, and I talk about that. And I feel like that's a very big step that I have had to accomplish. But I also think it's very important that you talked about the fact that there is a lot of different anxiety related issues surrounding diabetes. And I've been dealing with anxiety since I was like 11 years old, and I've been in therapy for that a lot of the times. But I recently actually got back to a cognitive behavioral therapist, specifically because I feel a need to control a lot of parts of my life. and a part of that is my diabetes. So for example, I can see what my percentage is of how many low blood sugars I have, which is only 5 to 6% of the time, which is really good, my doctor told me. But then again, it's just a general anxiety. Like I have anxiety when it goes up and it goes down, and it's just, I really wanted to have it really steady. And when you say it's very important that we talk about it and we can learn how to let go. And I often feel like my nurses at the hospital I'm currently at, they don't really acknowledge my feeling, or they know what's actually going on in a diabetic person's life. For example, today I had to go to the hospital, and I was talking to her about like, I'm feeling really anxious about like having a hypoglycemia during the night. And I was talking to her about that. And her reply was, I get it. And I was like, but you don't get it. You're saying that you get it, and we're going to talk about something else. And it did make me feel very alone. And that's often, like Marshall already said, an issue is where you're feeling alone, like you have to carry everything surrounding your diabetes 24/7. It can be very hard. And I think that stress also then shows again on your blood sugar levels if you're stressed out about your diabetes. And then it's just one big circle. So I think it's really, really important to get everybody on board and just talking more about the mental side of having diabetes, because that's something that a lot of nurses and educators are missing, I feel like, because we go there every 3 months or every 6 months, but sometimes we need to focus more on that part of diabetes than what are your blood sugar levels and are you in range and what's going on.
Thank you.
Yeah, I really want to say, yeah, I think I understand, of course, what you're just telling, Mirte. Like, not having diabetes myself makes it the biggest challenge for me. I think empathy is one of the most important qualities of a nurse, but it would be so much easier if you could, even for one day, actually feel what they are feeling, what you are feeling, to really understand them and try to help them. And sometimes it's very frustrating to feel like not helping your patient because the conversation is too difficult, or
But I want to say that there are also quite a lot of nurses that I had in my childhood who were really supportive and really understanding of all the things I was going through. So I think it's just a lot, like you said before, Alicia, about like educating yourself and wanting to know more, so you can really like connect with the people that are sitting in front of you, because often, because you go so regularly, you sit in those rooms, you kind of feel like a number sometimes, but it's nice to have that connection with someone.
Yeah. Well, I'm also happy that you can talk about it, because and don't feel ashamed. Like, you do not feel ashamed to talk about the alcohol part, but it depends on how easy or difficult patients can express themselves. And it's always easier, because sometimes they also keep quiet or passing the subject quickly or laughing it away. It's
I do make a lot of jokes, so it's good that I now have one doctor who can also like manage my jokes and can see through them, because before I had different doctors every other meeting, and then it was a little bit harder, but now relationship is good.
It's super important for nurses to read between the lines, I think.
I think that's the most difficult part of the job for every nurse, not only specializing on diabetes, but as a nurse, it's so important to read between the lines and not only, patients, everyone has his own way of coping with fears, anxieties, emotions. So you need to be able in a certain way to read what the patient is sometimes not saying. So thank you, Alicia and Mirte, because actually Alicia already in a way answered the question that I would like to end with. So it's almost 7, but I just want to close the meeting or the call with a question for Christina. So we had a long talk about from all the different perspectives, and I gave a lot of evidence-based nursing information, but is there something very specifically and very short that you can advise aside, or maybe with the 7A model that I already showed, what nurses can do, something very accessible for nurses when it comes to coping with fear of hypoglycemia, to close the call.
Thank you. Well, I think that nurses play an extremely important role in managing diabetes, in helping us actually to manage our diabetes. So then, yes, they would need to focus on emotions. As Alicia said, empathy is extremely important, but empathy doesn't mean, yes, I get it. It means that I'm actually listening to the patient and I'm trying to advise the patient as much as possible and try to do it in a non-judgmental way, just not to feel threat about it. And also fear of hypoglycemia and anxieties and all the mental health is extremely important for each and one of us. But we need to understand that people might not be able to just say everything at once. So maybe do it in time. Patient will tell based on a relationship. As Mirta said, once you have a relationship formed, a collaboration, then maybe the patient will be able to talk more about their feelings. So they need to feel comfortable and understood. And we know actually that nurses take care of a lot of patients, and it's so normal to do so, and we understand. But you know, we are in pain, we are suffering, and we want some attention. And in the limited time you have with the patient, maybe just try as best as you can to provide this. And this would be the best help to give to a patient. And also using the tools, as you said, even if it's a questionnaire or just some standard the questions you might ask to the patients, just do so.
All right, that's really amazing, very concise, and definitely what a lot of people need to hear. So we are 1 minute after 8, which is quite good and also quite challenging. So I would love to take the time to thank everybody to be here tonight and all the people who are still on the call. But a huge thank you to Mirta, Alicia, and Christina for this wonderful and interesting conversation. I think we can go for hours about this topic, but maybe we can go further in private. But for all the people who want to continue their night, thank you for joining. And with this, I would like to close the call and say have a good night further and enjoy your evening. All right. Thank you all for attending, and see you soon. Bye-bye.
Bye, thank you.
Bye. Good luck.
Thank you and well done, Maartje.
Thank you. Bye-bye.